Good morning, dear students. We wait some minutes another. Your classmates, participants, and start some minutes. Oh, today, Friday, and your level of working not full, not high. I see 35 participants of our lecture, and I know that it's 10% of all count of your flow. It's not good. Okay, I think all of us is understand that distant form one main problem, main achievement to side of this process. It's at first you have opportunity to learning when we stay on your home, lay on bed, and another problem is motivation to learning. And we see this tendency influence in education. I see a very big problem with students who learning offline. Is 5 course. We have discipline on this 5 course and postgraduate students because we have a feeling to learn 2 years in distant form, and today when students must come to classes and early morning, it's not only simple from students. And you may think about this, that I see a growth of count of our participant students. Okay, we start. I check my technical device. Please traditionally type me in chat if you see presentation. Yeah, okay. Please type in chat if you see a screen of presentation, and I remember some previous material. It's importantly we grows our knowledge. It's the same as a building and baseline. Some thank you students. I see your positive answer, and we start. And you see a topic on slide. Topic of our lecture is principles and rules of bioethics. And in first two first lectures we talk of common definition of our discipline. We try to understand why we must think about this discipline. We tell about the reason of born of bioethic, and remember that we divide three main type of reason of born of bioethics. And in 1971 Russell Potter create a new field of knowledge, new scientific branch, bioethic. And in previous lecture we have a mind exercise to try to separate some kind of questions in our practice. And you remember five type of questions in bioethic, and we have a practice to separate this type of question. It's important. It will be in our credit testing. And what the organization of our short course on the next week we must we have a final lecture on 2nd of February, and over them 1 minute we must plan our testing in portal. Yesterday I talked with my chief, and we see that your groups create in our portal, and we may have a credit testing of credit by 3rd of February. Yeah, it's yeah, Friday, good day. On this day you will work in portal with test, and after this whose students come to a level of 6% of right answer, have a credit, and other students will have a speech form interview by our discipline. And I think you understand that 300 students and one teacher, it's not равные, да, rights in this fight. Yeah, and I hope that all of us have a good level of knowledge in my discipline and work on tests very good. Okay. And today we talk about principles and rules of bioethics. Yeah. On the next lecture, we will talk about Hippocratic Oath. And today I doesn't pay attention to this slide because we will talk about this on our next meeting. And you see this principle, historic principle, and it was created by Hippocrates, and we talk about this. Today we start a lecture. I think we doesn't full our information in one time, and the next lecture we continue this material and may start a Hippocratic Oath. Yeah, and what the topic was the problem of this? It's principle of bioethics and rules of bioethics. We have two definitions: one common principles, yes, and one part of rules of bioethics. Yeah? In slide you see four main big principles of bioethics. Yeah? It created by Childress. You see data 1983. And it's Oxford University separate and introduce this kind of vision of this problem. And in modern we tell that it's full and common principles of bioethics and our medical practice. Yeah? At first you see non-maleficence, beneficency, anatomy and justice. Yeah? Today we talk about this principle, and at first we talk about non-maleficence principle. Or in another definition it may be named do not harm, or principle of minimized harm of our working practice. And all our action might be unpleasant, uncomfortable, painful, but this might involve less harm to the patient than what occur. We are not to have it. Yeah, we are not to have it. In practice, in some branch of medicine, for example, in surgery, in proctology, gynecology, it's a very actual definition, because especially in first step in medicine, when young doctor start her practice, we want to maximize the next principle of beneficency. Yeah? And we very want to help from all people on all over the world, and its tendency, it's understandably, it's described in many literature, resource, and you may read a novella of вылетает английский, когда ухожу из классической, да, медицинской парадигмы. Стефан Цвейг, новелла by Стефан Цвейг, name Amok. It's medical term, Amok. It's same in Russia. It's psychos, да, psychosis. When and I don't spoiler it this novella, да, this you may read this, but it's a history of one doctor in a hard situation in living when this doctor stay on Africa and have a practice in African village, and one black woman come to her and have some problem. I didn't tell about this. You may read, and in Zweig is a literature who describe very kindly, very detailedly describe internal world of people, of her actor, and Zweig describe feeling of a doctor very detailedly. It's very interesting to read, and you find this branch of problem of sustainable balance in our mind of doctor into this principle, non-maleficence and beneficency. You may read about this. And at first you think that young doctor have very many power and feeling to work, feeling to do many good achievement in her practice in this place where young doctors start to work. And on this time we doesn't think about principle of non-maleficence, and in our cathedra we was do some little research about doctors' mistakes in practice. Yeah. And when we ask our questions, our tests from young doctor, it's same reaction. What you want? You tell about mistakes in my practice? What happened? I don't know what you want. I work, everything normal. I were very busy, and please don't touch me. One doctor said that do of your want by himself. Find right answer by himself. What you want about me? And it's common situation when doctor at each time continuous of 3, 5, 7 years of practice. First time when we distribute in our profession. We doesn't want to think about side effect, about fails in practice. And at first you might think about principle of non-maleficence. Doctor must think about the good part of our activity and any kind of reason of any harm from our patient. And this principle include this information. Another side of this problem is principle of beneficency. All doctors should take positive steps to help our patient, and in practice, in the first time, we start very actively to do this principle. In Amok novel we see this two kind of two point of mind of this doctor, on kind of principle, non-maleficence and beneficency, and very different feeling and action of this doctor in this situation. Principle of beneficency include healthcare providers developed and maintain skills and knowledge. And it's common phrase, but I think it's importantly to understand this. I see 16 participants on our classes here, and what you separate of your students here. We separate skills and knowledge. In our working plan, we see two parts of all discipline. It's what students may do and what students might know. One it's term of our medical psychology course. One term of this it's burnout syndrome. Выгорание, да, по-русски это звучит как выгорание профессиональное. It's syndrome from a working field when we work with people. It's medical profession include this problem. It's teachers, it's psychologists, and one of big safety moment on burnout syndrome is your knowledge and your practice skills on your practice. If doctors think that it's only one right decision in this situation, and classic medicine come to this from last 10 years. We invite and very gross this impact of medicine based by evidence. All our treated, all our action might be evident. And in our clinical course, we read guidelines, we try to search world standard of treated your problem area in your branch of medicine, where we start. We will want to working Yeah, and it's we understand that it's an international approach to treat some problem, and if doctors know about this, it's a protection of our burnout syndrome. Yeah. We must try to do this action to help our people, yeah, and you know that it's a right, and you start this practice. Another side of this situation, yeah, that medicine, it's a very quickly growth discipline, and in some branch of medicine it's more quickly collected information in this branch. For example, the main growth discipline is discipline about our brain, and kind of scientific articles include twice from 1 year. Yeah. And today we see this situation when our practice fields, grows and grows, and we divide our discipline on different branch. For example, in neurology, some kind of neurologists stay and work with back pain, vertebral neurology, for example. Some kind of doctors come to another branch, for example, in one disease, Parkinson disease. And its tendency in medicine, it's named one doctor, one disease, and in neurology you see this. Another branch, it's maybe vascular problem, vascular disease, cerebral vascular disease, specialists. And it's included in Hippocraticus. We talk about this on next classes. All doctor must continue to update her skills and grows your knowledge. Okay, it's principle of beneficency. Yes, it's another side of problem of non-maleficence. Yeah, and all our action must be sustainable in these two principles. Yeah. Next principle of justice. Benefits and risks should be fairly distributed. Principle of justice. Our practice must open all kind of some not visual problem with health, for example, and it's on internal feeling. It's simple. I don't sad about this, and I stay in comfortable situation. And if patient doesn't ask about this problem, I doesn't tell about this. But in some cases, we must tell about some problem, and we will stay in this principle, principle of justice. For example, at first, fair distribution of scarce resources. Very not simple situation, and if from me, for example, come my colleague on my consultation, for example, or if my colleague call me and have some questions about her relative, for example, and they come to my consultation, I try to help us more than in my traditional practice. It's another principle of medical communities, for example, and in this situation, for example, where I am describing this, doctors try to distribution of resource in this patient, and if we will think about some benefit of helping only this patient, we take decision in this situation. Okay, students, if you hear to some problem in our classes, I want time to understand what happens. I think everything normal in our cabinet. It's interesting when I come in big corpus of university at only one teacher, because our students on a session and our professor in online, and I stay in this big auditory. You may see this kind of working and speech with some technical device. Okay. Next, what? The distribution of resources. Historic fact. It's flyword of our famous organization, organized of medicine. In our history, her name is Simashka, and in Soviet Union they organized our medical structure in our country, and he was said this phrase that a good doctor will supported by our patients, and bad doctor doesn't need of our country. And it's traditional course of medicine in Russia. Yeah, doctor not very consultation of doctor not very expensive in our country, and the count of doctor from 1,000 of citizens, it's very big. Yeah, from another country. I know the information that in 3-5 course of count of neurologists in Russia, we have more big specialists in our country, but the level of salary not yet good all time, and social role of doctor not big, and in pandemic situation we especially growth of our practice. Yeah, but what I think about this distribution of resources is one of a reason why we include your knowledge and skills in only these cases, only this patient in this time, or in another time in another patient we doesn't fully turn on your skills. Yeah, it's a reason of some ethical problem, principle of justice. Yeah, it's the same and understandably competing needs. Yeah, in practice. And next branch of principle of justice, it's rights and obligations. Yeah. Права и обязанности. What its name? We will talk about confidentiality principle. Yeah? And all patients know her rights. But not only yet we know about our obligations in practice. And in medical psychology we talk about some communicative skills, yeah, in our practice, and it's very importantly because our obligation, and at the first step of medicine, in the first course, we may think about this. Our obligations, it will be comfortable on communication with patients. And you understand that when our patient come in doctor cabinet, they doesn't smile, they have a depression, emotion, they feel some pain, and it's problem. And some branch of this is problem of communication with this patient. And stay in this position. It's your obligation to make all activities comfortable and careful, and try to realize the principle of beneficency. Yeah? And potential conflicts and legislation problem. It's the same situation when doctor have some hard work, hard day, you may work on a night, for example. In our country we have a practice to work one day, all day and night, and not simple. In surgery, for example, it's hard work, and we have degrees low of our psyche potential, and it's a reason of some conflict behavioral in medical practice. Yeah, you may think that you may know that it's in principle of bioethics we must stay on a good feeling to try to realize the principle of beneficency, yes, and be justice in this situation. The next principle of anatomy. Yeah, you see a definition. Yeah, dictionary said that it's self rules. Yeah, and all of us, I know Russian, think about only my rules in my life, in my practice, for example, and we write all our rules on a blood in our practice, and the first step of education, you may think about this and make your future practice in your mind in this position. All practice, all situation will stay in your practice, described in our material. But our patient have this right, yeah, and have this opportunity to realize the principle of anatomy. Yeah, and all decision of our patient, it's only decision of our patient. And we try to push this decision in own right situation from our mind, but it's not simple when we see some psyche problem with patients. I think about anxiety, I think about depression, and in practice, when this patient come to cabinet, it's not simple dialogue. When you ask some questions and patient give simple answer, yes, no, or doesn't give any answer, and in this situation we try to push our visual of situation. We may try to give some treatment from this patient, some examination, or if you need to separate this diagnosis. One case in my practice in previous week, I come to a home with to patient, and I see an old woman, and I have some difficulties in diagnosis. I see a common situation, and I understand that it's maybe very frequently may some problem with brain, but I doesn't differentiate it what of this problem. and I tell about needed of scan of brain, but in this time old woman on a hospital and in computer tomography, it's very dangerous from coronavirus situation. And I understand this, and relatives understand this, and we talk about, and I push my opinion and call in emergency services, and they come to a hospital and do this examination, yeah, do scan of brain. But in finally, we doesn't have any dangerous diagnosis in this situation. It's only problem with arterial pressure, and it's the same arterial hypertension, and one kind of in focus we talk about this. It named острая гипертоническая энцефалопатия, yeah, acute hypertension encephalopathy, yeah, in English it's maybe same. And in this situation, in this case, at first I realized principle of beneficency, yeah, because I in my visual I see very high potential of problem of some kind of diseases, stroke, for example, tremor, yeah, because the patient have dysanastosis. And in a reason, I have some difficulties to communicate with relatives and patient, because I am first reason of any difficulties in examination, any risk of coronavirus, for example. And when doctors think about this, and what happens if these patients are disseminated by coronavirus, and it's maybe a reason of death of this patient, and what I must feel in this situation. I am a reason of death of my patient because I describe some examination, yes, in hospital. But what I feel when if this patient die from stroke, not diagnosed stroke in the home, yeah, it's a more big problem. But in this situation, if patient said that I doesn't do any action, this patient realized principle of anatomy, and we doesn't have opportunity to have a right to press opinion of our patient, but we must try to realize a good practice in this case. Some problem of this, we talk about medical psychology about this, that all specialists, all your colleagues understand what happened, that you have difficulties because all neurologists understand what happened in my practice, and it's normally, but in our country, I don't know what happened in your country. I think that's the same situation in all country. More popular grows the people rating of doctors. And because we have an internet resource to give some отзыв, I don't know in English, some opinion of a doctor, patients write in internet, and all potential patient, at first read this opinion of another patient, so this doctor, and take decision who is this doctor in this situation. Yeah, but in the future or in the past we have very different situation when patients search and find your doctors. They ask about colleague of this, and it's not simple multi-cross function working in our practice. And principle of anatomy, we must realized all right to anatomy of our patient. Yeah, it's only decision of our patient. What aspect of realized principle of anatomy? Yeah, at first, mental capacity, full information and non-coercion. We start to talk about this. At first, mental capacity. Yeah. Decision-making process, you see. At first, doctor must know that all information understand and retain in these cases by patient. Yeah. In our country, very frequently we see these situations, and doctors said, okay, give me this information, write a single in this document, please, and patient see big document and try seeing this very big information. Patient doesn't read this singular, and doctor do some action. Yeah? You may think about if we have a fail in this situation, yeah? Some errors in practice. It's a first reason why we have a problem, because we doesn't describe any aspect of your treatment, of your action, of your operation, and patient doesn't full picture of this situation. Yeah, and we talk about, yes, understanding it's some mental capacity problem. From in our practice we see this some disease of brain. Yeah. Pro and contra aspect. Yeah, very frequently, if I want to push in comfortable for me decision, I very finally talk about pro factor on this treatment. I tell about, in my case, from my old woman case, yeah, I talk about some problem with stroke, some trauma problem. I doesn't tell about, I think about this, but doesn't more tell that it's maybe simple situation, but I watch to a potential problem and push my opinion to search all reason of this potential problem. Yeah? But in practice we must weigh pro and contra. We must talk about potential benefits and potential harm in all situation, and describe this, and it's a communication skill of doctor. Yeah. Make a decision in their own best interest. Yeah, in a level of mental capacity. Yeah, it's some aspect of this, and communicate the decision. Yeah, I told about this. Okay. Full information. Yeah, it's action of practice when we have informed consent. We talk about this. It's rules of bioethics, yeah, and realized some rules in next classes we talk about. We in practice, yeah, we recommended some kind of treatment, and we describe this treatment, but we only doesn't tell about any alternative method. Yeah? And you must talk about this, because when patients come out of your cabinet, search this problem in internet, read diagnosis and search in internet. If they search some alternative methods and doctor doesn't tell about this, it's one of reason, not opinion from your practice. And you may tell that we have three type of therapy your diagnosis. In your situation, in your individual variant, I separate this treatment, and we realized, and we will hope that the reason of this treatment is this variant, and you described it. But we must tell about alternatives method, yeah, and tell about why we separate only this decision. And frequently the reason of separated, it's comfortable treatment not from our patient, it's comfortable from a doctor, yeah, because it's a simple, yeah, when treatment some drug have a very hard process of describing, yeah, some aspect of commission described the therapy. In our practice we have this very expensive drugs, very side effect drugs. We have a practice to commission describe this therapy. It's not simple. In all countries, medical work on a paper all time, and see 1 minute see a patient and see this document 1 hour. It is the same situation in all countries, yeah. This alternative methods, it's one kind of reason to talk about this, yeah. And we may remember that you must talk what happened if we doesn't have any treatment, yeah? And in my practice I realized this, and because sometimes I see a recommendation when doctors write diagnosis and write recommendation 1, 2, 3, 4, 5, 6, 7, 19, 12, 20. And all I think that all drugs, what this doctor know, he described in this recommendation. what happened if we doesn't treat, and what happened if we stay one drugs, and what happened is if we plus one drug to this therapy, what opportunity we have in this situation. Yeah. We must talk about this with patient, and it's a principle of full information. Yeah. In 5 course we learning this produce these skills of communication when we speech some part of information and check understanding. Yeah. Give some information and check understanding from patient, and it's a practice. Yeah, you understand this, it's understandably. Very frequently we include these questions in our speech. Yeah, and check understanding. Doctor must use some simple word to describe this situation, and it's your professional skills. And in my practice I have any frame, any template from a patient in IT specialist patients, for example, or driver patients, for example, with lower back pain, for example. Yeah, some old patients. Yeah, when we simple describe situation in not used any jargons, any terms, да, in our speech. Yeah. We used diagrams, we use any templates, yeah, in our practice. For example, I needed to create my YouTube account. It's only 5 years, and I needed to create video answer of very frequently situation in our practice. Yeah, I create this video, share it in YouTube, and said that you may watch this on this material. Yeah, we used not only diagrams, you know, the pamphlets and internet research. Resource we include in our practice, and it's very have a very high growth in our practice. Yeah. Okay, next principle. I think it's in finale of our time we talk about principle of non-coercion. Yeah. It's understandably our decision is made by the patient. Yeah, it's for kind of area of speeching. Yeah. Relatives, society, religion, and medical practitioners, yeah, doctors, yeah. Our definition of adequate time to think from our patient, its skills, its practice. When we ask, do you ready to talk about this problem? At this time, you ready to discuss your disease, yeah, and what we must do this on this situation, yeah. And if patient said that I'm not ready, I need to time, I want to stay alone, and think about my disease, or frequently they will say that it's I want to communicate with my relatives, and it's normally it's one of aspect. And some patients said that it's only I want to need all information about disease. Please, doctor, tell me full information on the time, and I'm ready to discuss what I must do. Okay? And relatives. Society, in a non-coercion principle, you understand that frequently pressure of our society norm biases our decision. Yeah? Religious, yeah, in previous lecture we tell about religion questions, religion and cultural questions in our practice, yeah, and sometimes it's difficult even to a principle of bioethics, non-coercion, in this situation may be realized. Okay, dear students, I think it's because we stay on half of our lecture, yeah. Yeah, okay, and we uncompatible patients, I mark the place when we stop today. It's in your focus in neurology cycle. We talk about situation when we observe the incompetent patients. It's situation with coma, depressed, intoxicated situation, and what would the patient want? These questions not only have a right answer, yeah, and main what we must do in this situation, it's documented all aspects of this situation, the patients in competent patients, yeah, and we documented this. Okay, we stay on some practice, yeah, scenario, yeah. We start our next lecture on this part, and continue to describe this. Okay, thank you for attention. I think today we start to discuss our principle and rules. It's huge topic, and you see this tendency, yeah, that a hard information, simple, not big, but understand this information. It's not simple. We must talk more, some cases to understand this simple word. Yes, principle of beneficency, non-coercion, non-maleficence, do not harm, and another example of our practice. It's good exercise to your mind. Thank you for attention. Goodbye, and our next lecture will be, I watch in my schedule. Oh, Monday, good time to have a 2 lecture of bioethics. Yeah. Bye bye. Thank you for attention.